everyone, and welcome back to Clinical Cousins YouTube channel. Today we're going to go over furosemide, also known as Lasix. This drug is classified as a loop diuretic and is given for many conditions in which we need to decrease our blood volume, such as edema, hypertension, pulmonary edema, and acute hyperkalemia and hypermagnesemia in ACLS. This is one of the most important drugs we will learn about because it is so effective and widely used. You should not give this medication if your patient is not producing urine. Also, use caution when giving this drug because it can cause severe fluid and electrolyte imbalances. Also, it can even cause ototoxicity. In pregnant women, this drug has a category of C, so use extreme caution when administering this drug. Now, to make this drug so easy to understand, we're going to understand how furosemide works on a cellular level. If you follow along, I promise this drug will be so easy to you. Now, here I've drawn a nephron, and we all know that fluid is filtered and acted upon until the end result is urine. Now, after our fluid has been filtered and acted upon by our proximal convoluted tubule, it makes its way to the loop of Henle. You should know that about 25% of our sodium and water is absorbed by our cells in our thick ascending loop of Henle. Normally, our thick ascending cells, which I have drawn one here to represent this whole section, our thick ascending cells have a blood facing side and a urine facing side. On the blood facing side, or basolateral side, this cell has a sodium potassium ATPase and a chloride channel. Now, on the apical or urine facing side, it has what is called a sodium potassium 2-chloride cotransporter. Also, it has a leaky potassium channel. Normally, our cell will suck the sodium, it'll suck the potassium, and it'll suck the chloride from the urine so that we can reabsorb it into the blood. At this point, it means that sodium, chloride, and water will be entering our blood. But potassium does something funny. It finds a leaky channel and makes its way back out to the urine. Why does it do this? Well, we know that potassium is positive, so it will naturally make this space outside the cell in the urine more positive. This positive charge will actually push our positive calcium and magnesium between our cells and back into our blood. This means that normally, under normal conditions, our cell is taking the sodium, it's taking the chloride, it's taking the water, it's taking the calcium, and it's taking the magnesium back into our blood. Now, you will be able to tell me what happens when we block this cotransporter with a drug like furosemide. When we block this cotransporter, it means that sodium, it means that chloride, and it means that water and potassium will be lost into our urine. Because potassium is lost into our urine, we have nothing to make the tubule more positive. This means that we will have no positive push for our calcium and magnesium to come back into the blood. This means that we will lose our free water because water follows sodium. We will lose our sodium. We will lose our potassium. We will lose our chloride. We will lose our calcium, and we will lose our magnesium. All because we blocked this cotransporter with a drug like furosemide. Now that we understand this, you should understand that this drug will raise uric acid levels in the blood. This means that your gout patients will be more likely to have gouty arthritis flare-ups in their joints. This drug has an onset of about 5 to 30 minutes, depending on the route. and it'll have effects that last for 2 hours. Now, the side effects of this drug may include hyperuricemia, think gout, hypokalemia, which means eat your fruits and vegetables, polyuria, hypocalcemia, hypomagnesemia, hypotension, muscle cramps from the electrolyte imbalances, and tinnitus. Some commonly tested material about this drug is that it is a powerful loop diuretic. It will decrease our patient's blood volume. You should use caution when giving to gout patients, and it will likely result in frequent urination, hypokalemia, hypocalcemia, hypomagnesemia, and hypotension. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.